So you have to go for supination pronation, not with the flexion extension of your elbow. It has to be like this. See? You have to, your elbow has to be fixed. You should not get striking. Yeah, like this. So like supination pronation. See? So you can perform it with two hands also. So that your what you call it as the ulnar border of ring finger, little finger, ring finger and middle finger should strike the patient's skin like this. Okay, so this is what you do. I see this powder is irritating. What you call it as? Hacking. Okay, this is called as hacking. What you do, you have to spread your fingers. You have to see to it the ulnar border of little finger, ring finger and middle finger striking the patient's skin. What movement you perform? You make the elbows with the flexion and then you perform supination pronation of.
Okay.
Where it happens supination pronation?
The superior radial ulnar.
So this is hacking. Okay. Next is what you call it as clapping or cupping. Okay. So you have to cup your hands. Okay. Cup your hand and then by making it hollow. Okay. So that you have to perform like this. Okay. So you have to perform at the speed of. Perform like this. Is it paining? No, it should not be paining. If you do like this, it will be paining to the patient. Okay, what you do, you have to your starting position should be like this. You have to have a flexion at the elbow and then you have to hollow your hand. Okay, you have to hollow your wrist and then you have to go for flexion extension movement at the wrist. See, not at the elbow. Actually, you have to do. If you do it at elbow, why it is to be avoided? See, because if you do it from elbow, it will be painful to the patient. Okay, the slapping will be even harder when compared with flexion extension of wrist. See, it has to be come like this. So per minute you have to cover. Yes.
The movement in the wrist.
Yes, movement of the wrist. So it has to, you should get some hollow noises like this.
The sound should be there.
Yeah, sound should be there. That means, see, generally your technique is like you have hollowed your wrist, you have hollowed your hand good. Otherwise, like it will go like this. So when your finger strikes the patient's skin, it will be painful for them. So always get this rhythmic sound when you're teaching the alternate hand, you get the sound like this. Just free your wrist and you go for this side.
You make it like rhythmic.
Yes?
You make it like rhythmic.
Yeah. See, you have to go like this. See, it will come in practice only. Where first, there will not be synchronization between two hands. You will be like, when you start performing, you will be like this only. So you will not get the rhythm like with two hands. So you have to strike, the alternative strike should be there with the hand. Otherwise, initially if you start with, you will not get this, you will get like this. Okay. Perform it slowly with the bed and with the pillow, and then you will get it over the patient's skin. So these are like what you call it as the percussor. Okay. So what you do, so you have to keep it like this. If you have a problem with striking of your hand, so this is known as the percussor. Okay. So this is not a mechanical one, but still this will give you the
for cupping technique.
Yes.
This.
Usually, like when you work in ICU, then you will find all sort of problem like by striking your hand. Like you have to use number of cases, maybe 9 patients, 10 patients in ICU, all the cases you have to work with the secretion clearance. So for that, what you do, you can use this percussors. Use manually. See, this is for adult, and this is for children. This one, see the small cup, you can see the size. This is for children. Okay, so this is child percussor, and this is adult percussor. So you can use both. If you have a problem with the striking, then you can use any of this percussor. Okay. So this is known as percussion. Percussion, what you do, you will have a starting position of like this. You will stand aside of the patient, and then what you do, you make your elbow inflection, and then you go for striking action, like with hollowed or else cupped hand. Okay, so you should get a hollowed hand like this, and you have to go for alternative. So it has to be more than 200 strikes per minute. So if you strike it in a rhythm, you should get it around 200 strikes per minute, 60 seconds.
Yes.
So that means you have to go in 1 second, at least you have to give 3 strikes. Like this. 1 second, at least you have to give 3 strikes. Okay. And then what is that? Percussion is over.
Bounding.
Next with
Bounding.
pounding. Pounding is like this. Okay, you hold like this. This is like this one. So just you have to pound over the muscle with your ulnar border of little finger. You have to fist your hand. Okay, you have to make fist with your wrist, and then what you do, you go for striking action. So this is also like that. Either you can see, you have to perform slowly. Okay, so there should not be like what you call it as a rash striking. It should be it will be painful to the patient. So you have to go for a gentle beating, pounding. So this is known as pounding. You have to pound. Just if you put it, just jump. Like penny. Okay. So this is pounding. And next, so pounding you have to perform with the closed, clenched fist. And next is beating. Beating should be performed like what you do. You have to make a flat surface with your fingers. Okay, it's like you're making a flexion at the proximal interphalangeal joint and extension in the distal interphalangeal joint, and then go for striking. So this is like you do clapping only. You have to perform flexion, extension at the wrist. Yes. Not like that. You have to make a flat surface like this. You should not allow your knuckle to come on the way. See, it has to be flat like this. Yeah. Yes. So you have to perform flexion, extension of the wrist. Yes. So this is beating. And next is tapping. Tapping, actually you can see, I told you, right, in many of either spastic muscle or flaccid muscle, in order to facilitate the contraction in the muscle, what we do, we go for tapping. Come on, contract, contract, contract. Flex your elbow like that. So you have to give command verbally as well as you go for tapping the muscle. So you can do it from origin to insertion, or else you can do it over the where you have a big muscle mass. For example, if you take quadriceps, it's not big over the origin and it's not big over the origin and insertion. So if you want to there is a muscle mass in the middle, so you tap it over in the middle, so that most of the muscle fiber will get stimulated. So that will give you good contraction. So this is known as tapping.
I'll check through of sciatic muscle.
Yes. Usually that's performed in case of what you call it as sport. Usually, this is for either the spastic muscle or the flaccid muscles. And then, so this is with percussion. So percussion, hacking, cupping, and then pounding, and then beating, and then
Tapping.
tapping. So tapping you can what? Yeah.
This is hacking.
Hacking.
And this is
Hacking. And next is cupping. Cupping you perform. Then pounding. Pounding you have to perform it with the clenched fist, and your ulnar border of little finger should strike the patient's skin. Or else you can say we should pound the patient's skin. Okay. And next is beating. Beating you have to make a flat surface by doing flexion in the proximal interphalangeal joint and extension in the distal interphalangeal joint, so that you are making it straight to strike it. And then you perform flexion extension of wrist. Tapping, it's like this. See, you can use the pad of all 4 fingers and then you just tap. Not like this, not slapping, it's tapping. Okay?